a doctor in New York City, who recently returned from treating Ebola patients in Guinea, became the first person in the city to test positive for the virus Thursday, setting off a search for anyone who might have come into contact with him. Spencer, a 33-year-old emergency room doctor, was working with Doctors Without Borders and returned from Guinea more than a week ago. Officials were contacted after he reported a fever and gastrointestinal symptoms, according to a statement from the Commissioner of the New York City Department of Health and Mental Hygiene. 4 American aid workers, including 3 doctors, were infected while working in Africa and were transferred to the U.S. for treatment in recent months. All recovered. Officials have attempted to reassure New Yorkers that the city and state are safe. City health officials repeated that Ebola is difficult to contract, since people must come into direct contact with body fluids of an infected and symptomatic person. Many fears about the disease have swirled around New York's status as a transport hub. Airports in the metropolitan area process most of the passengers arriving in the U.S. from West Africa every day. John F. Kennedy International Airport and Newark, New Jersey's airport are among only 5 in the U.S. permitted to accept passengers from the worst affected countries: Guinea, Sierra Leone, and Liberia. As part of the New York governor's Ebola preparedness plan, 2 ambulances are regularly stationed at JFK and Newark airports. The city's transit authority was provided with protective gear and training, and unannounced drills are being conducted at airports, college campuses, and in subways. The governor designated 8 hospitals in the state to handle Ebola patients.